Good afternoon, everyone, and welcome to the Nurse's Corner with your nurse, TANEISHA COLQUHOUN. Today we are going to be talking about the topic leptospirosis. According to the Merck Manual for Medical Information, leptospirosis is a potentially serious illness caused by a species of the spirochete Leptospirosa. Leptospirosis occurs in many wild and domestic animals. Some animals act as carriers and pass the bacteria in their urine. Other animals become ill and they die. People acquire these infections through contact with infected animals, their urine, or soil and water contaminated by infected urine. Although leptospirosis is an occupational disease of farmers and sewer and slaughterhouse workers, most people become infected while engaging in outdoor activities such as swimming or even playing in the water that is contaminated. And we all know a common rodent that leptospirosis is passed through is the rats. Yes, house rats. Symptoms and diagnosis. Leptospirosis causes mild disease in about 90% of infected people, whereas 10% have severe, potentially fatal diseases that affects many organs. The first phase starts 2 to 20 days after infection with the leptospirosa. Symptoms begin abruptly with a fever, headache, severe muscle aches, and chills. The eyes usually become very red on the third or fourth day. Nausea and vomiting are also common. Symptoms involving the lungs includes coughing up of blood. Episodes of chills and fever, which often reaches 102 degrees Fahrenheit, very, very high fever. This continuing for 4 to 10 days. The fever then clears for a few days, marking the beginning of the second phase. During the second phase, the body's immune reaction against the bacteria causes inflammation, producing many symptoms. The fever returns and there is often inflammation of the tissues covering the brain, and this causes the neck to become very, very stiff, headache, and sometimes even put persons in a coma. This is known as meningitis. In the severe form of the infection, people may also have inflammation of the liver, the kidneys, and the lungs, and this results in jaundice, kidney failure, and again the coughing up of blood. Sometimes the heart is inflamed, causing palpitations and dangerously low blood pressure, and this can lead to shock, and shock is an emergency where the person can die. Therefore, leptospirosis is a deadly disease. A pregnant woman who develops leptospirosis may miscarry. 90% of the time they miscarry because of the complications that happens. A doctor can diagnose or can confirm the diagnosis of leptospirosis by identifying the bacterial leptospirosa in cultures of the blood, urine, and cerebrospinal fluid, detecting antibodies against the bacteria in the blood. A doctor can also diagnose leptospirosis by hearing the family history, right? They can also listen to the background of the person and the address. So wherever there are a lot of rats, persons usually tend to get leptospirosis, or wherever if it's a stream and there are rats near the stream, then you can diagnose leptospirosis based on the symptoms and the address of the person, where they get their source of water from, etc. Prognosis and treatment. Infected people who do not develop jaundice, they usually recover. Jaundice indicates severe liver damage, and that increases the death rate in people older than 60. Antibiotics are also given. The antibiotic doxycycline can prevent the disease, and it is given to persons who were exposed to the same source as an infected person. Penicillin antibiotics or similar antibiotics are given to treat the disease. In severe infections, antibiotics may be given intravenously. People with the disease do not have to be isolated. However, care must be taken when handling and disposing of their urine, because you can become contaminated if you touch their urine as well. That's it today for the Nurse's Corner. Before I go, I would like to leave with you the health tip for the day. The health tip for the day is: healthy living is not just what you eat or how much you exercise. It is also mental health. Again, healthy living is not just what you eat or how much you may exercise. It is also mental health. Once more, I'm TANEISHA COLQUHOUN, and thank you for tuning in to the Nurse's Corner. See you again next time, same place, right here on Tops Radio, where we have another topic to discuss. Have a wonderful afternoon, and remember, healthy living is not a goal, it is simply a way of life.
All the pain is getting worse.